Hi, I'm Dr. B. I'm going to talk about blood pressure lower in tips. This is an important guide to lower the blood pressure. So what is high blood pressure or hypertension? If you are taking hypertensive medications, you are already considered as a hypertensive patient. So the normal blood pressure is 120 by 80 millimeter mercury. You see there are two readings. First reading we call it systolic blood pressure and second reading we call it diastolic blood pressure. Right, so this is 120 systolic, 80 is diastolic. This is the normal blood pressure for an adult. So what is defined by hypertension? A blood pressure more than 140 by 90 millimeter mercury. So a blood pressure 140 by 90 or more is considered as hypertension. Right? If your systolic blood pressure is more than 140 millimeter mercury, or if your diastolic blood pressure is more than 90 millimeter mercury, is considered hypertension. It can be both reading or it can be only one reading. That is the important thing. It can be only systolic or it can be only diastolic or it can be both systolic and diastolic blood pressures. Right? So that is the definition for blood pressure. Anybody having a pressure at or more than 140 by 90 millimeter mercury is considered hypertensive patient. Now you see there is a gap now, right? Normally is 120 by 80. So anybody who has blood pressure, systolic blood pressure between 120 to 139 millimeter mercury or diastolic blood pressure between 80 to 89 millimeter mercury is known as pre-hypertension. It is just before the hypertension. It is not a disease. Pre-hypertension is not a disease. You don't have to get treatment for pre-hypertension. It's a risk category. It indicates that you are at risk of getting high blood pressure later in your life, in near future. So you can take precautions that we will be talking of. That is pre-hypertension. So what is pre-hypertension? Systolic blood pressure 120, 39 and or diastolic blood pressure 80 to 89, right? Maybe one of them or maybe both of them, right? If they are at that range, then we call it pre-hypertension, right? So remember, it's not a disease, it's a risk category. So it needs some modification of your lifestyle, right? You don't need drugs to control pre-hypertension. So first, this is the lifestyle modification. Lifestyle modification is the most important activities that we have to do in controlling blood pressure, right? So you have to, if you are a hypertensive patient, if you are on medications, you should follow lifestyle modification. That is very important, right? If you follow lifestyle modification, you might be able, your doctor might be able to reduce the number of medication that you take for high blood pressure. Not only that, even the dosage of medications, and also it reduces your risk of other diseases like diabetes and heart attacks, heart disease. They also will be reduced if you follow the lifestyle modification, not only blood pressure, right? And in the case of pre-hypertensive patients, this is the only thing that you need to follow. Lifestyle modification is the only thing you do. You have to do some behavioral modifications that we are going to talk of. So these are the components of lifestyle modification. There are several components. Number one is weight reduction. So it is important to reduce your weight. As I said earlier, it will reduce high blood pressure. It will also help to control your diabetes. It will also reduce the risk of getting heart disease in future, right? So weight reduction. You have to reduce weight at least 10 pounds or more. Right, normal BMI is less than 25. Body mass index, right, normally is less than 25. It can be calculated by using a calculator, or it's the body weight in kilograms divided by height squared. Height in meters squared. So that is the normal BMI is less than 25. If your BMI is more than 25, it is overweight. If it is more than 30, it's obese. If you're considered more than 30, it is considered obese. So being overweight and being obese increases the risk of having high blood pressure, increase the risk of getting diabetes, and increase the risk of getting heart disease like heart attacks, right? So it's important to lose weight, right? Keep your BMI below 25, right? If you can reduce at least 10 pounds, right, then it will have a noticeable effect, right? So what do you have to do? Lose weight, you have to eat less and exercise more, right? Take less intake and more output, right? Exercise. Then second component of lifestyle modification, moderately intense physical activity, right? Using moderately intense physical activity like brisk walking, walk fast, right? At least 4 days a week. That is very important. And if you are a heart patient, you have to take the permission from your doctor to decide your ability to do this activity actually, right? So if you are a heart patient, moderately intense physical activity, as I said, brisk walking is the common thing, right? 4 days a week, at least 30 to 30 minutes, right? Duration is 30 to 45 minutes is enough. Number 3, moderation of alcohol intake, right? If you take more than 2 drinks per day, it increases the risk of high blood pressure, right? When you compare to a patient who doesn't take alcoholic drinks, right? If you are at higher risk of getting high blood pressure if you take more than 2 drinks. So when I say 2 drinks, what is a normal drink? A drink is defined as 5 ounces of wine or 12 ounces of beer or 1 ounce of hard liquor. That is one drink, right? If you take more than 2, then you are at risk of having high blood pressure if you take regularly. The number 4, low sodium intake, right? Your daily sodium intake should be 100 millimole per day or less. 100 millimole. If you measure in sodium chloride, that is 6 gram of sodium chloride. Or if you measure in sodium, it is 2.4 gram of sodium or less, right? That's the maximum that you can take, because if you take more sodium, that is more water, right? More retention of salt and water. That makes the blood pressure go up, right? That is, so you have to take low sodium. Don't add extra salt to the diet, right? So reduce the salt intake. That is the important important thing to do, right? Then number 5, DASH diet. DASH means dietary approaches to stop hypertension. DASH diet. What is DASH diet? A diet rich in fruits, fiber, grains, vegetables, and low fat, right? That is DASH diet. DASH diet is important in controlling not only high blood pressure, also diabetes and heart disease. Then also eat more fish, right? Fish is important in reducing weight, right? Then also caffeine and smoking. Caffeine and smoking, they can increase your blood pressure transiently. If you go to your doctor to check the blood pressure after taking caffeine or smoking, the blood pressure can be high. Doctor might increase your dosage of the medication. So because they can transiently increase the blood pressure. So it's important not to take, especially before going to a doctor. Then smoking cessation and lipid lowering, they also reduce the blood pressure and they also reduce the risk of heart disease. Smoking cessation is very important, and lipid lowering. Stress reduction is also thought to reduce blood pressure. So it might lower the blood pressure, stress reduction. And then also avoid taking drugs that may increase the blood pressure. What are the drugs? Such as NSAIDs, right? Non-steroidal anti-inflammatory drugs that are normal painkillers that you take because they are over the counter. Ibuprofen, naproxen, right? So those, if you are taking those medications frequently, because they cause water retention. So they might increase the blood pressure. So if you are taking these medications frequently, you might have to reduce their intake, right? Then oral contraceptives, estrogen in oral contraceptives retain the water. So avoid oral contraceptives if you are hypertensive. And also some nasal decongestants, the nasal decongestants that you take for sinusitis, right? So if they have stimulants such as pseudoephedrine, you should not take them because they can increase blood pressure, right? So nasal decongestants containing stimulants such as pseudoephedrine should be avoided, right? And so I hope you enjoyed this description and about the blood pressure lowering tips, and I will see you in the next episode. Thank you.